Okay, so after the attack rate or the number of new cases of disease that has developed per the number in a healthy population who are at risk at the start of the period, we have naman our morbidity rate. So for morbidity rate, this is the number of existing or new cases of a particular disease or condition, right, per 100 population. So it measures the portion of people in a specific geographical location who contracted a particular disease during a specific period of time. So if mortality is the number of deaths, or it measures or quantifies the deaths, no? For morbidity naman, it quantifies those who have contracted the disease or those who had the disease. So this would be existing cases of diseases or disease conditions or even new cases of it. So that would be your morbidity rate. For survival rate naman po, it is the number of living cases per number of cases of a certain disease. So living cases or those who have survived or those who have recovered over the number of cases of that particular disease or the number of cases of disease itself. Next naman po is the live birth rate, which is the total number of live births per 1,000 population per year. The number of live births or the number of okay, um, living births or yung mga nabuhay na mga bata over the total number of births. This is per 1,000 population per year. For birth defect rate naman po, this is the number of children that were born with defects per 10,000 births. So the number of children with defects divided the total number of births. No? So it is measures per 10,000 births. So, these are the references. So, that's it po. So, medyo naputol. Sorry po because um, uh, there's actually a internet connection problem a while ago. Pero in summary, understanding population characteristics, the health, disease dynamics, and the measures of disease occurrence is fundamental in epidemiology. So populations are defined based on their common attributes. So yung nabanggit natin kanina, no? Based on the common characteristics that they share, whether that be their place of residence, their age, the use of their healthcare services, or even life events like the one we see in fixed populations. Okay, kapag naman po the use of healthcare facilities or healthcare services, we have there the catchment populations. And this may vary based on different factors such as service availability, and even the socioeconomic status of the patients. So there are patients who may not afford some of the tests or some of the laboratory tests or some of the services that healthcare facilities may offer. So because of those, they may not avail of such services or they may not be part of that catchment population because of budget constricts or okay, because of financial constricts, no? And aside from that, no, even the establishment or enhancement of services in healthcare facilities may catch or attract certain patients who are in need of such services, or di kaya the addition of a very specific service that would cater to the need of those who have that specific disease. Like for example, kung ang isang patient ay naghahanap ng psychiatrist, so he or she would probably look into hospitals who would offer such services. So, dadami or di kaya we would have an increase in the catchment population if there is the addition of a particular service that is in need or in demand sa isang particular population. So we also have the fixed and dynamic populations natin, which may exhibit different membership criteria. So we also have defined health, which is the not only the absence of disease or infirmity, but it also encompasses the holistic well-being brought about by physical, mental, and social well-being. So diseases may not only be limited to contiguous physical or communicable diseases, but it can also define mental health illnesses or the disruption of any of those physical, mental, social, behavioral, psychological well-being of a person or anything that may disrupt the holistic well-being of a person may be part of our disease, especially po sa ating epidemiology. So we cover not only the cases of those who have a contagious disease, but also those who have mental health illnesses or stress-related illnesses or even accidents, you know, so that this is still part of the disease or the um, frequency of diseases that we quantify. So disease definitions, as we have mentioned a while ago, this evolves with advancement in medical knowledge. So if the knowledge back then, for example, kung yung kay John Snow, if without John Snow's contribution to epidemiology, they may not be able to postulate that cholera was spread by water. So every disease may have a different definition as our knowledge of science or health and biology and even the etiology of diseases increases over time. So we may define a particular disease or infection based of the current knowledge that we have of it. So kung madadagdagan pa yung information natin of that particular pathological organism, for example, and even the disease that it caused, so ma-update yung definition natin of that disease. Okay, so disease definitions, yes, evolve. So disease occurrence also measures ratios, proportions, and rates, and they are used to quantify disease burden and risk within populations. So we're done with ratios that have compared the relationships between two numbers. Proportions, yes, this is also the relationship between two numbers. However, they are correlated or related to a whole, WHOLE. And also the numerator is simply a subset of the denominator. Okay, and we also have our rates and their incidence and pati po yung ating prevalence. So calculating disease occurrence requires considering the number of cases, population size, and observation duration. So this is also important that we standardize, no? Yung parang kanina, we standardize our data in order to ensure accurate comparisons between populations of varying sizes and even follow-up periods. So we mentioned yung mga incidences natin kanina which measures focus on new disease events and it aids in disease prevention. At the same time, causation studies or the etiology or the causes of certain particular diseases. Prevalence naman po, on the other hand, it measures not only new but even existing disease burden or the consistent presence of a particular disease in a particular community. So this would inform resource allocation and even healthcare planning. So what can we do para mabawasan yung cases na ganito? It has been prevalent in that place for some time. So what may the LGUs do for it? Anong program kaya yung pwedeng magawa, no, for this chronic disease that has been in the community for so long? So real-world examples illustrate the application of disease occurrence measures in public health research and policymaking, highlighting their importance in understanding population health and guiding interventions for disease prevention and for disease management. So that's it. Thank you po for listening and I do hope po na marami po tayong natutunan. So thank you and God bless us all.